So welcome everyone. We are now going to start the webinar presentation on accuBooks. So can we have the slides up please now? Thank you. Can we have the next slide please? So this evening's webinar, after my introduction, we're going to cover a number of areas. What is accuBooks? We're going to cover what the patient experience is, the practice's journey in terms of what they need to do to set up accuBooks, and also the areas that the practice need to do in terms of uploading their patients onto the accuBooks platform. We're also going to have at that point in time, we're going to have a pause for some Q&A, and then after that we're going to talk about what actually happens at the hub itself and the role of the hub staff, and then we will have another Q&A at the end for any other further questions that come up. We'll also try and answer as many questions as possible using the chat function that we have. So let's start with what is accuBooks. So accuBooks is a web-based IT platform which allows the booking of our COVID vaccination program. The key elements of accuBooks is that it allows direct booking by patients, which is really, really important going forward. So it enables patients to choose the time and site of their vaccination, but also it allows them to change the appointment if that's not convenient for them. And it also allows them to cancel appointment if, for instance, they have no transport or they are unwell prior to their appointment. It also allows some control by the practice to upload the patient cohort list in terms of which priority group, but it also allows the practice to manually book patients who may not have a smartphone or have a mobile number. So it makes sure that we are covering all our different groups in terms of their ability to use IT technology. What's really, really exciting is that accuBooks is currently working with the Immunisation Management Service to try and integrate the system to allow us to have real-time knowledge and identification of those patients which are due a second vaccine, and to determine when that second vaccine is due. So this is a high priority for accuBooks. It will go live. They obviously have still got a little bit of time to ensure that happens before the 12-week window, but we are absolutely assured that this will happen. So I'm going to hand over to Shanker now, who's going to talk about the patient experience.
Thanks, everyone. So here is a video that should be helpful, and you may have seen this before.
This video shows the patient's experience when you use accuBook. When you invite your patients to book their COVID-19 vaccination, the patients with mobile phones receive a text message like this. If you click on the link, you can book your appointment. It loads up a web page in the phone's browser. There's a link there that the patient can click on to learn more information about COVID vaccines on the NHS website. If they click on continue to booking, it asks them to do an identity check where they enter their date of birth to confirm who they are. If I do that now, and then I click on confirm date of birth, it then shows me the locations that I can attend for my vaccination. So here we have Dominion Centre in Southall and Ealing Town Hall. And it tells you that appointments are available at those sites, and you can click on to continue booking. So let's book an appointment at Dominion Centre. It shows us the slots that are available. If you click on show more options, it will show you even more slots that are available. But if we just go for the first one, here it says it confirms the location, the time, and it gives you the option to click confirm booking. It also gives you some guidance about what's happening with your second vaccination. Let's change our mind. Let's click on edit first slot. So we can change the time. So let's go for later time, and then again click on continue. And it's now changed the appointment time, and I can click on confirm to book it. And that it is. I've booked my appointment. It shows me the location, it shows me the time, and it's going to send me a text message. There it comes, as a text message arrived on my phone to tell me what's happened. And That is a further confirmation. Let's change our appointment. If we want to do that, there's already an option at the bottom, manage your appointments. So let's click on that. We can click on cancel and rebook. So it's now been cancelled and it's asked us to start again. And there you go, another text message has arrived on my phone. At the top you can see, and that's telling me that it's been cancelled. So let's continue to book. And again, it's asking me to confirm my identity. So let me do that now and click confirm date of birth. So we're back to this page, which allows us the locations to book from. This time, let's go for Ealing Town Hall. So click to continue, and it's showing me the slots are available. So let's pick that and click continue. Again, it shows me the confirmation, so let's confirm it. And the vaccination's completely successfully booked. So it shows me the location, the time, and yet another text message telling me what's happening. Let's this time cancel it completely. So let's go to cancel. So we've cancelled it completely and start again. And there you go, another text message telling me that it's all cancelled. This time, let's go for I don't want to book right now. Let's click at the bottom. Again, it's asking me to confirm my identity. So I'm going to enter my date of birth now, and then I'll click confirm date of birth. So now it's telling me, are you sure you don't want to be vaccinated against COVID-19? So it's asking me to confirm that with a click. And I'm going to say continue. Now it's asking me for more details. Why don't I want it? So here's a drop down list. So I've got, I'm currently too well. I'm currently pregnant or breastfeeding. I've had an anaphylactic reaction. I've had it done, something else. Let's go for something else for the purpose of this. And it is, I am just making a video to demonstrate it. accuBook. Okay, so that's my answer for opting out. So I'm going to say confirm opt out. And this shows you the text message that were received. So it just shows you the sequence of every time getting the updates to the phone about cancellations and rebooking. And it always has a link to rebook or cancel if need be.
So that was the patient's experience, and just to reassure you, it's not just a mobile-based experience. accuBook can handle all your patients who haven't got a smartphone or haven't got a mobile at all. What's the next step of the journey for the practice? So that was the patient's experience. What's the practice experience? Well, look, if this patient can make all the effort to get to Ealing Town Hall in that device, in that electric mobility scooter, I'm sure we can go through the journey of accuBook. So where do we start? It depends what your practice's use of accuRx is at the moment. You may have downloaded it in all your desktops, you may have got all your practice staff to use it, and then it's quite straightforward. Or it might be that you didn't actually get all your staff members to use it, or you're using it in a different way. So we really want your admin and reception staff to now have it downloaded on their machines and be set up as users if that hasn't happened already. And then we need you to accept a delivery site invitation. Now, actually, that's gone really well. We've only gave instructions on Monday, and nearly everyone has done that. Now look at this amazing team in front of us. This team at Dominion waiting there for our patients to vaccinate. We've got to do our part and get them there. And at this point in time, we've got 6 practices left. We did have a lot more at lunchtime, so it's been great that we've got down to 6. And email instructions were sent out on Monday. But for those 6 practices, can we get them to do it by tomorrow?
So if you have your accuRx desktop running up here, mine is whirling around because my SystmOne is not open. So if you click on your initials, that gives you the menu. And if you go down to manage practice and click on that, this shows you all your practices. Now with yours, you may have just your practice listed. I've got lots of different things listed, ignore that. So if I click on my practice, so Cloister Road Surgery, and this new section appears, COVID-19 vaccine, and it says new. And if you look at it, it says accept delivery site request, and it says pending request next to it. So if you click on that, and again, ignore this Cloister Road Surgery listed in current sites. But here, if you look lower down, it says pending approval requests,
and it's got 2 listed. So at the moment we have Ealing Town Hall COVID Local Vaccination Service and the Dominion Centre COVID Local Vaccination Service. So if you look to the right, there's 3 dots, and if you click on that and then click on approve, it says, do you want to join the delivery site? So you click on join, and then you've got the next one, the Dominion Centre. So if you click on the 3 dots and then you click on approve, again it says, do you want to join this delivery site? So you click on join, and now you can see that both of them, Ealing Town Hall COVID Local Vaccination Centre and the Dominion Centre, are listed on your current sites. That's it.
Let's hope that's the last time we ever need to play that video. Let's get those 6 on board by tomorrow.
So
Vijay,
I just want to remind, so those 6 practices which currently haven't accepted the invite, it's really important that they do this, because if they don't, they won't be able to book any of their appointments. We will be removing SystmOne as our booking system when we go live with accuBook. So it's really important. We had 16 at lunchtime. We are now down to 6. So these last 6 practices, it's really important that they accept the invite that they have received to ensure that they are enabled for accuBooks.
Thanks, Vijay. So I'm now going to pass it over to Alex, and here you go.
Thanks, Shanker and Vijay. So I'm Alex Fragoyannis, one of the other clinical leads for the CCG. I just want to briefly walk you through the invitation process in terms of how you invite patients from your SystmOne system, and how you create a CSV file and how you then upload that file. But just before we do that, we're just going to play a little video from a colleague, a very useful video from a colleague from County Durham, just explaining how you might book using the Covid-19 accuBook menu. Okay, so if we could play the video.
I'm going to talk through now how to actually invite the patients. So from that home screen again, what you want to be doing is click on invite patients and manage bookings. And that'll bring you to this screen, which contains the list of patients who've already been invited at the bottom and the opportunity to invite new patients at the top. So I'm going to demonstrate how to invite a list. So you click on that and it would give you a screen that shows you the opportunity to upload a CSV file containing all the patients that you want to invite. The next step after that, which I can't demonstrate here, would generate a list, and it will say we're going to invite, obviously I have a list of 200, 100 we've got mobile numbers, and they'll be sent text messages. I'll come back to that in a little bit as to how that all works. So there is another screen after this. Going back a screen, you can also click on invite an individual. So let's say, for example, you decide that, oh, we've got a healthcare worker who's not on the original lists, but we need to add them. Rather than create a CSV file just for one patient, you can just add a single patient to invite them individually. So the next step, as I was alluding to, is a booking of the patients into the appointments. So what accuBook does is, in its best functionality really, is that if a patient has a mobile number, they will be sent an SMS text message with a web link where they can then book themselves into the appointment. And that is by far the easiest approach. And we're seeing hundreds of patients using that successfully, which saves our administration teams a lot of time. Unfortunately, some patients don't respond, but you can still book them in manually, which I'll come to demonstrate in a few minutes. And then we've got patients who don't have mobile numbers, for whom you'll have to manually book them in. It's important to note that all patients can decline their booking as part of the process if they don't want to be booked in, and I'll come to that as well. So back to the list of patients. What I've done here is I've ticked to manually book, and I also ticked to await response, and you'll see the numbers change for the total number of patients. So to manually book are the patients for whom we don't have a mobile number, and we're going to have to phone them up and manually book them in. Awaiting response are patients who have been sent a text message but haven't responded yet. Now, if you've just sent the text messages, clearly they probably will book in at some point. But if they've been waiting several days, maybe we don't have the right mobile number for them, or maybe they can't use the technology. So it's nice to then phone those patients up to make sure that they're not missing their opportunity. When it comes to manually booking the patients in, the approach that we've used is we give our receptionist access to this screen, and our reception team work down the list And on the list, I've blacked it out on this screen, but there's basically a patient name and their telephone number. So without having to log into any separate systems, they can phone the patient, say, hello, Mrs. Jones, I'd like to book you in for your COVID vaccine. And if they say, yes, that would be wonderful, they can click on book. That then takes the receptionist to the same portal that the patients see when they click the link in their text messages, which suggests two options: continue to booking or I don't want to book right now. If they click I don't want to book right now, they can give a reason, and it will then add a decline code onto their medical record to say that they have been invited, but they've declined their invitation. If they continue to booking, it then tells them where their appointment's going to be, and then it tells them, they ask them for their date of birth. If it's a patient being booked in by a receptionist, that's pre-populated. They don't need to fill that in. Obviously, if the patient's booking on the mobile phone to verify their identity, they do need to put that in. And then it gives a list of appointments that they can choose from, and they can click on that appointment time, and it will then take them through to the option to confirm and accept their appointment. And once you click confirm and accept, the appointment is booked and the patient gets a text message immediately to confirm their appointment. So it's really simple when the patient wants to book in. Sometimes you may try phoning a patient and you can't reach them, or you phone them and they're in hospital or they're out of the country. And in those situations, you then obviously don't want to have to phone them again, because otherwise you'll spend your whole time phoning the person with the surname of A over and over again because they're not available. So the process we're following is click on the details tab, and that brings up some extra options. And then you can add a note to say Mrs. Jones is in the Algarve. And then we click more and cancel invite, and that then takes them off the list, so that you don't phone them again. You can, if you cancel the invite, don't worry, you can add them again. So it's not canceling the opportunity to have the vaccine, it's just canceling the invite. So it takes them off that screen so you don't phone them twice.
Okay, thanks, Shanker, for controlling the video. So I just want to briefly run through the process of how the admin teams within each practice might create a CSV file following running a report of the appropriate patient cohort, and then how you upload that CSV file onto accuBook. And apologies, this is all a bit dry and not as interesting as the previous videos and slides, but this is actually really crucial. If you get this bit wrong, you're not going to be able to invite the right list of patients, and you're not going to save administrative time in as efficient a way as you could if you get it right. Okay, so from that perspective, this is a set of slides just to show you what to do, and it's actually really simple. So you pick a report as shown on this slide. I've picked a report that says total patients who are 80 years old plus and who are still yet to have their first dose of COVID-19 vaccine. So we run that report and then we show patients. Next slide, please. And then you are, obviously we can't show you the patient list because that's patient identifiable info. So that's blank underneath, but you're interested in clicking the button that has a red rectangle around it, which is select output. So we click that button, and then we're presented with another menu. Now, this is a way to customize the output of the SystmOne CSV file. So you're interested in the predefined report output, which is the third option down. If you look at the top three options, you've got default report output, ad hoc report. We're interested in the predefined report output. And what you want to do is click accuBook CV19 CSV output. This is a Northwest London wide shared output that works with accuBook. So not every output that you might create or that you have already in your system will work with accuBook. And the reason for that is because accuBook requires some very specific fields and nomenclature of the fields for it to actually upload your patient list. So I know and appreciate that some practices may already have created custom outputs, and maybe the next bit might be relevant for you, but very, very simply, just click predefined report, click the accuBook CV19 CSV output option and literally click OK. And after that, your report will refresh. Again, you're seeing a blank page where the patient details would be because of PID, but check your columns. Okay, so you need, these are the minimum prerequisite columns that accuBook requires. And in fact, you don't need any more than this. This is all you need. So you need the title of the patient, name, surname, date of birth, NHS number, and really crucially, mobile phone number, because the more mobile phone numbers that you have, the less administrative time you're going to need to phone patients to ask them to book their appointments. So they should be able to hopefully use the technology and just book by themselves. That's the whole point of all this, to save everybody time, particularly at the practice end, but also for patients as well. They don't have to phone the practice or be phoned to book specific slots. So once you've got your columns there and you're happy and you've got your patient list, you click on Save to CSV. So Shanker, yeah, if we move a page, then you will be presented with your CSV Excel spreadsheet. Just again, check the columns which are highlighted in the red rectangle. And after this point, you just simply save the file at an appropriate location on your computer so that you can find it. And then after that, you're ready to upload the CSV file. This screen is accessed through accuRx, the accuRx site. So once you go back, as was shown earlier on in the video from the colleague in County Durham, you click on Invite Patients, and then it gives you the option of uploading a CSV file. Next slide, please. And once you've done that, again, as was shown earlier in the video, you'll see a list of patients, some of whom will need to be manually booked, but hopefully most of whom will be able to receive a text message automatically and directly. So next slide, please. So here is the actual output. These are not real patients, so we're allowed to show them to you. But the report will be split, the uploaded report will be split into these two sections. So patients who can receive SMS invites and those who can't, who have to be booked manually. And if you click continue, you will be able to go to the next dashboard, which will allow you to proceed with the manual bookings as required. Okay, so that was the simple bit. The next bit, I mean, you can switch off if you're not interested in it, but for practices who want to customize their CSV file, with particularly adding columns with extra pieces of data, just a quick run through of how you might do that. On the screen that we saw before, when you click the select output button at the top, after you've shown all the patients, if you click predefined report output again, but then what you want to do is create a new predefined report output. So you click that button and then click OK. And the next screen shows you how you go about creating the columns of your customized report. So you click the Add New Output button as highlighted, and then you click on Demographics, and then on the bottom, roughly bottom right of that window, there's a little button which, when you hover over it, says Add Column, and that is literally adding columns to your CSV report. So you want to add the relevant columns for the accuBook requirements. So if we click on that, we're presented with another menu. Now this is a sub-menu of all the demographic options that you've got. So we clicked demographics earlier as an output. These are all the sub options of demographics in terms of how they would be displayed in columns. So I'm not going to spend too long on this, but essentially here you can pick whatever you want, but the prerequisites, so if we scroll through these slides, Shanker, so you populate each one, and our guide shows you how to do this, so you don't have to worry too much. But this is the important slide. For accuBook to actually work, whatever your other fields might be, other columns within your custom report, the bottom right corner, which is annotated with number 1, need to be present. Otherwise, your report just won't upload into accuBook. Okay, so you must make sure that whatever custom output you have on your CSV file looks like this. Okay, and if in doubt, look at the guide, and it's very straightforward. It's just literally clicking a few drop-down menus and adding some text, and it will look like this slide. Okay, next slide, please, Shanker. So once you've done that, again, you look at, you press OK, and you look at your columns and make sure that your columns are the correct ones that you need, and then you save. You save to CSV. Okay, so the CSV then file opens like we showed before, and hopefully your columns are what you expected. So next slide, please, Shanker. So that just before we go on to the next bit, that in a nutshell is how you create and your CSV file, and then are ready to upload. We can take questions about this later, but one of the common questions is, well, what do you do if people don't have a mobile number? What happens to them, etc., etc. So, and some patients, they don't have a mobile number themselves, but they may have a carer or a neighbor who they have allowed to have a mobile number within their notes. And you may not always be able to tell that just by looking at a patient list. So unfortunately, there's no easy way around it. The custom output will pick up mobile numbers, and it will pick up usually the preferred mobile number. So that's the one it looks for first. But actually, if there's a mobile number in another field and the preferred number has happened to be a landline, it will still find the other mobile number, the mobile number in the other field, the non-preferred field, so that you can still text those patients. So your mileage will vary in terms of the practice, your practice, and how it enters, how you enter mobile numbers in patient records. But ideally, if it's in the preferred field, it will be found.
So this slide is trying to represent something, and Vijay will pick this point up as well. Don't overload the accuBook. What we're trying to say is that the way the system is designed is we create a vaccine sessions, like number of slots at Ealing Town Hall and Dominion, and accuBook will only allow us to upload 200%, so 2 times as many patients as slots. There's a reason for this. If suppose there was only 10 appointment slots and we uploaded 500 patients, they'll get a really poor experience. They'll click the link, see no slots available, they'll get really frustrated, they'll probably call the practice, and you know, everyone will be taking up calls. So we can't overload it. Second thought behind that, though, is we've got to work together. If we have 75 practices and we all share in these slots, if one practice uploaded every single patient, then the later practices will just be told by accuBook they can't upload their patients, and that's because we've used up too many slots. So that 200% or 2 times on slots is a really important thing. Vijay, do you want to?
Yeah, before I talk about this, I just go back to what Alex said. To be honest, what I would suggest that most practice just keep it simple. Use the preset accuBook outputs that we have designed across Northwest London, and you would be able to generate your CSV file with all the preset data outputs you require. If you want to bespoke it in any way that you prefer, then that's fine. But on my suggestion and my recommendation is that most practice should just continue with the preset accuBook CSV output preset, which we have developed across Northwest London, which is published, and it will make it just simple for all practices to use. Going back to what Shanker said, this part is really important in terms of not overloading the boat. The way that accuBooks works is that each session, for instance, if you have a capacity of 500 slots. How accuBooks works, it allows you to invite 200% of your capacity. It does not allow you to have upload any more invitations than that. So it's really important going forward that when we do release the sessions across Dominion and Ealing Town Hall, we will have a fixed number of capacity. So it's important that we don't have one practice trying to upload 500 patients, and hence another practice is unable to do that. So a communication will go out to all practices in terms of a cap, which is similar to what we had previously when we had a SystmOne ledger, but it'd be much more broader in terms of the numbers that you can book. But we need to keep some kind of cap to allow all practices to upload patients for text invitation, but also for manual booking as well. And that's really, really important. We're now going to have a little break now, so give you a chance to ask any questions on that first part of the webinar, particularly around some of the technical issues that we've just described.
Vijay, can I answer? I think we've answered most of the questions as we go so far, but Vicky had a question around, so if you have 200 patients and 100 appointments, that means 50% of patients can't book, and so that sounds like a lot of frustrated patients. So
we can answer that. Yeah. So do you want to answer it? Yeah. Please.
I can answer it.
Yeah, please.
So Vicky, so initially, so actually to say, you can, first of all, you can customize the text message that goes out to patients, and you can be actually very clear about what's going to happen. So we are planning to, on a rolling basis, release vaccine sessions for the week ahead. So that is likely a lot more slots than...
There's also a couple other factors. Sorry, like you said about. Oh yeah, sorry, Karen.
I was going to come to it, but yeah. So there's going to be a lot more slots than just the one session or the one clinic that we perhaps have been used to before. So it's less likely that the clinics will be fully booked, and then patients won't be able to book again. Now, the other bit is that even if the patient is unable to book at that point, when a new session comes up, their link remains live, and actually they can try again. And again, you can reflect that in the text message that is sent to the patients. Shanker, sorry, I know you want to come in.
Just as a Vicky, there's also a couple other principles. When you upload 200, not all of them will use the automated system. Some of them will not want to have the vaccine. Some will only have landlines, so they won't flood the system. They won't all have a mobile experience. A lot of them we will find will have home mobiles that the practice is manually booking, so you won't flood it with 50% not being able to use a link.
The other thing to say is that the patients, every patient who receives their text message, so the link remains live, so they can book at a later date. But actually, if they get reminders, so they get reminded at least twice so far, and I think that might be changed by accuBook. There was something in their development WhatsApp about this. So currently they're reminded twice, and if there are no slots, it's actually quite an intelligent system. Once slots come up, the reminder, if the two reminders haven't been sent, the reminder then is sent to remind them to book when a slot becomes available. So and as it goes, it becomes even more, the functionality increases, and it becomes a much more smooth and efficient system. So I don't think on an ongoing basis we'll have a problem with bookings and unhappy patients.
Just to say, so that alleviate any frustrations, we are in the process to release probably about 4,000 slots next week. So there will be plenty of capacity to ensure that all our over 80s are done, and also we'll have the capacity to do all our 75s at least as a minimum. So we are going to be releasing about 4,000 slots next week. So yeah, bear with us. That will be going live very shortly.
And in fact, as you see, like the hubs deliver more and more, and they become more 7 days a week, this may become less and less of a real issue that you can, that the caps can sort of almost fade away, hopefully. Are there any other general questions? Or I know there's some chat comments. what will we do? So Catherine's asked, what will we do if practices do upload more than the allocated number? Very good question. We can ask them to remove them. You can delist it, but it will be fiddly. We can sort at our level into how many are in each practice. But I would hope that we just don't get to that stage. And like Vijay said, it may be just initially as we up ramp volumes, and then hopefully we can be more relaxed about it.
Yeah.
And there's also just a general, like if someone just did the wrong cohorts and uploaded lots of patients, that could also create an issue.
Yeah. Okay. I don't see any more questions now. So should we move on to the next part?
Okay, so this is slightly simpler. This is the vaccination site's role of what they would use from accuBook and what do they need to know. First important point though is if you are a hub staff member that you're working in those hubs, particularly in an admin or reception role, I'll urge you to please email me with your NHS mail address so that we can add you on to being part of the vaccination service hub so that you can access it at that level, not just your practice level. Can I also say, if you do get access at both, please don't confuse the two. Don't upload your patients into the wrong one, but upload it into your patient thing. And also we'd ask you please keep off sections that you don't fully know, and in particular the vaccine session functionality that you may have access to, and we'll pick that up again as a point. But we're going to welcome back that GP to tell us a little bit more about the hub role.
Then we come to vaccination day. So we've got our clinics all fully booked and we're ready to go. So we then this time around come back to this screen and we're clicking on booked list. So this is a clinic at the top here that we've already had back in December, and as you can see, all 66 appointments that we were offering had been booked in. The process that we're following is to generate some QR codes to make it really easy to add the patients to Pinnacle. So I'll quickly talk through that. So we click export and that will download a CSV file of all the patients in order of their appointment time in that clinic. You then go to the vaccine QR generator, which I've developed, which you can download and run on your computer at this link, or you can run it on the web at the link at the top. And there's a full YouTube video which explains exactly how to use this in much more great detail than I'm going to go through here. But in essence, you upload the CSV file by clicking on choose file and then uploading it. And then it will generate you several pages of A4 that are filled with these QR code slips, which you print off in your printer and cut out into individual slips for individual patients. Then when the patient arrives, reception will click on open clinic for the clinic that they're operating through, and they'll be given a list of patients in appointment time order. So when you find the patient, you click arrived and that marks them in on the system, and then that logs them for future reference so that you can tell who's been and who hasn't. The next step would then be to hand patient their individual identity card. So that contains a date of birth, their NHS number and their name. They carry that through the clinic and they hand it to the clinician when they reach the point of the vaccine delivery site. The vaccinator will then open Outcomes for Health and click on the button to start a new provision record, a new vaccine record. And then they'll scroll down to the patient details section. Now, if you don't have the QR codes, you can still do this. You just have to manually type in the date of birth and the NHS number and look them up. But as anyone who's tried that will know, it's a slow going process because no human being is very good at writing a date of birth in that format. If you've got a QR code scanner and you've got the QR codes, this is super easy. You simply click on the date of birth and then using your QR code scanner, scan the QR codes and it automatically fills in the date of birth and the NHS number from it, and you click look up. So within a few seconds, you're ready to go and log the patient onto Pinnacle, so the official vaccine record is done.
So I just want to recap that. So first of all, on accuBook, it's a really simple system. You saw a screenshot a little bit. It's not like SystmOne. You don't mark arrived, gone. It is just a tick. Some areas are not even using that because they don't think it adds much value and they're doing it very manually. accuBook allows you to export the CSV file again. So I know we're talking about CSV files a lot, but accuBook has one click to export it out for that clinic. And then this is a very simple piece of software made by a GP, that GP that you saw in the video, and you just put that file into there and it generates endless QR codes. So, you know, if we had the whole day's clinic and we generated it at the beginning, we could then sort it, and you can sort it by surname or we could sort it by session type. yes, there is risk with lots of barcodes going around that we give the wrong patient the wrong barcode. Yep, that's definitely risk. Still, the vaccinator will need to check the identity when they do that. But what we also hear is that, you know, acoustics and stuff, it can be really difficult and time consuming to take that time to get the details, and then the manual entry. So this could speed up the process a lot, and all the sites that have done this have found that speed advantage. So that's the thought of how that could evolve at the hub level. I imagine there's going to be a little bit of teaching each other. So, you know, when you do shift changes, people that are working in that in the hub, when they've learned it, may need to quickly show the next person. But it is a very simple, basic system. I wouldn't even describe it as an IT system, more of a tool.
Yeah, so what's important about going back to the screen before, in terms of having the QR code and the scanning, you know, in terms of what's been done in people and other hub experience, you probably can save about 60 seconds per vaccination. So in effect, you know, throughout a day, if you're doing 1,000 vaccination, that is a lot of time that you can potentially save if you're able to enter the patient's NHS number and date of birth using this QR code, and this is what we're going to implement at both our sites, hopefully when we go live at the end of this week.
And Vijay, another important point.
Yeah, so this point is really, really important. Those people who have, you know, everyone who has access to the two hub domains, in terms of Dominion and Ealing Town Hall, you will also have access to actually the clinic setup. And really, what's really, really important in this situation is that we do not want anyone to start to interfere in how the clinics have been set up, in terms of session start time, end time, patients per hour, capacity, etc., whether the session is live or not live. So everyone who has access to this, particularly the administrators working at the vaccination hubs, mustn't try and interfere with how the clinics have been set up, and that's a real massive health warning. You know, it's really important that they don't do that.
So here are some useful links. These are links. So in this webinar, we've used some video clips. Often we've done that because patient identifiable information is difficult to make them ourselves, and people have spent time to do that. But this product is changing constantly. It is literally, like, if you've used accuRx earlier on this year, it's similar with accuBook. It started just weeks before the national program was announced for PCNs. It's changing every couple of days. They've even accidentally, like, even when Vijay talked at the beginning about the NIMS integration, you can even see they've accidentally showed it sometimes in their recent videos in the last few days. So I imagine things are going to keep going live. So that's why we've got that Ealing accuBook support group, because we might flag change, we might have to show things to each other. You know, you may open it the next day and it's got some additional functionality. So definitely join that group. I know that we're all WhatsApped out, but if we try to not overload that group, then that would be great. And then we're going to upload some of those video clips that we've done, and those are some links to the video clips that we've used in this presentation, and we'll circulate that out to people. One really important, and I think is actually here.
Said it was the most painless injection he's ever had.
Fantastic.
Well, let's hope he says it's. But Adam, are you on? Can you come off mute? What do you think, Adam? Do you think it's fantastic?
Yeah, no problems with the first vaccine. A little bit rough with the second one.
You're meant to talk about accuBook.
Sorry. Yeah, I think it looks brilliant, to be honest. Actually looks fantastic. Easy. Save a lot of time for practices.
Yeah, thank you, Adam.
Okay.
So we're really coming to the last 15 minutes now. So it really just gives us an opportunity for you to ask any questions. Either you want to put your show of hands on the MS Teams, or any other questions on the chat. We can spend another 5 minutes doing that, and then I will just round up with some sort of take-home messages in terms of what practices need to do over the next 24 hours.